Now, I know it's only September, and flu season seems like it's a long way off, but it's actually closer than you think. And with school starting now, it's a perfect time to start getting your family prepared. And to help us do that today, we have Arlington's very own Public Health Director, Dr. Reuben Varghese. Dr. Varghese, thanks so much for being here with us today.
Tara, it's a pleasure to be here. So I want to make sure people understand what to do this year.
Oh yes, the flu season is upon us. And one of the things that I question is, when is the flu season? You hear that some people are suffering through flu season now, some in the spring, some in the fall. When does it actually run?
Tara, it's an excellent question. In the U.S. and in the Northern Hemisphere, the flu season is from October to April. What sometimes confuses people in the Southern Hemisphere, it's their fall and winter season when it's the flu. So when it's our summer, it's their flu season in the Southern Hemisphere. And then the other things that sometimes people get confused about is, well, we're seeing seasonal flu. It happens between October and April. Well, now we're also talking about pandemic flu. And this year we have the likelihood of having both the seasonal flu starting in October, as well as seeing the pandemic strain everyone's been hearing about, H1N1, is already here and is going to continue. So we'll have two flus to be dealing with.
Now, what is the difference between the regular flu and the pandemic flu, the H1N1?
The regular flu is more predictable. We have an idea of how it operates in the human beings that we see today. So we know that in the U.S., unfortunately, 36,000 people often die from flu or its complications, that up to 200,000 people get hospitalized, and of course, many millions actually get ill. But it's predictable and we know the consequences. H1N1 or other strains that are pandemic, we don't know how they're going to operate. What we see so far, it seems to have the same severity as seasonal flu, but what we don't know is going into this fall and winter season, will it get worse? And so we want people to be aware and to take the precautions they can so that it can reduce that possibility of even being exposed to the virus, so that why take the chances if you don't have to? And it applies to even seasonal flu, so terrific, we're going to actually kill two birds with one stone.
Help both ways.
Exactly.
Which leads me to, what are some ways that people can prevent getting the flu, whether it's the seasonal or the pandemic? What can we do?
There are some tried and true public health behaviors that are simple and effective. So when you hear us talk about washing your hands with soap and water frequently, we're talking, do it for 20 seconds. That's very effective.
Okay.
Then cover your cough with your sleeve or with a tissue, not your hand. Stay home when ill. It's a way to prevent the spread of illness to others and helps you to recover. And then finally, when there's a flu shot available, get one. So get a flu shot if it's available. But the first three, if you do it regularly, it will reduce your risk for getting the flu and help reduce the spread of illness to other people.
Well, one thing I know in the way the economy is really tight right now, a lot of people feel like they have to go into work, they have to be troopers, they have to make sure that they show up and help the company. But that's something that people shouldn't do if they're ill. Is that correct?
Absolutely, Tara. People should stay home when ill for two reasons. First of all, you don't help yourself if you go into work sick. You're not taking the time to rest and taking the time to recover so you can recover quickly. Second, when you go to work or send your child to school ill, you're actually putting others at risk, and I don't think anyone is doing that intentionally. We don't want to get other people sick, and we forget that. So there are two reasons. Help yourself recover and protect other people. So stay home when you're sick.
Stay home. And how long should you stay home? Because sometimes you start to feel better and you become this trooper, like I know a few people that do this, and you go in, and then it makes it a longer recovery period. Is there a time frame that's best for people to stay home?
The rule of thumb in public health is when you are symptom-free for a full 24 hours, and that's without taking at least any of these anti-fever medications. So therefore, you should be off of Tylenol, you should be off of ibuprofen, those sorts of medications. If you're off of those and you're symptom-free for 24 hours, then we consider it safe to return. But we're going to still encourage you to wash your hands aggressively and cover your cough and encourage others to stay home when ill.
Now, the vaccinations, I know I'm hearing this in the news a lot. Is there going to be enough? There were trials that were done this summer, I believe. Are there going to be enough for everyone, and who should go out and receive the vaccinations?
That's a terrific question. And as I said earlier, there are two types of flu that are going to be circulating likely this fall. We'll have the seasonal flu vaccine, which we had already been prepared for, and the manufacturer of that vaccine has continued. And everything we are aware of to date, it's on schedule. That vaccine should be available. And so people should start getting it when it starts arriving in October. They have several months to do it. Those who are in certain risk groups, especially the very young, the elderly, and those with certain medical conditions that their doctors have talked about, they should make sure they get the vaccine early.
Okay.
What we don't know is whether there will be, when the H1N1 or pandemic strain vaccine will be available. We know it's under production, but until we know it's going to be coming, we can't provide it. And so what, in either scenario, the seasonal flu vaccine or pandemic flu vaccine, those tried and true behaviors, remember to wash their hands with soap and water frequently for 20 seconds, cover their cough or sneezes with their sleeve or with a tissue, obviously stay home when ill, those will still be necessary even with vaccine. So we need people to do that, because there have been years where there has not been seasonal flu vaccine or not enough, and yet when we ask people to do that even more, we've seen it in certain areas like schools, the amount of transmission has decreased. So it's really quite effective. It doesn't seem like a magic bullet, but really it can protect people.
So how about schools? Will children be receiving vaccinations there?
Tara, that's actually one of the possibilities. In Arlington, we have a special relationship with our public schools. The nurses who are in the schools and the aides are actually members of the public health division, and so we collaborate routinely on outbreak investigations and helping prevent the spread of illness. So when the vaccine becomes available, should it be available and delivered in the public sector in that way, we'll make it available and we'll work with the schools and see what's most effective. But what we need to remind parents and teachers, they're going to be excellent role models if they can demonstrate the behaviors that we've been talking about. If they demonstrate to the kids that how important it is to wash your hands, how important it is to cover your cough, and how important it is to stay home when ill, who better to serve as role models for kids, and we'll be able to conquer this problem even better.
Oh, see, that's great. All great advice. Thank you so much for coming out and talking to us. I know it's on the forefront of so many people's minds, and we really appreciate your time today.